COVID pneumonia have shortness of breath. Most, but not all people who have low oxygen levels have shortness of breath. But there are some people with COVID-19 who don't necessarily feel short of breath despite having COVID pneumonia and despite having low oxygen levels. Does that mean you should run out and buy a pulse oximeter? Maybe. Before you decide on whether or not you're likely to possibly benefit from a pulse oximeter, let's understand some things about them. A pulse oximeter is a device that measures the saturation of oxygen in a person's red blood cells. For most people who are healthy, the oxygen saturation is 100%. That's the highest number that anyone can possibly get. There is no 110% here. Most devices will clip onto your finger. They work by measuring the amount of light transmitted or reflected through the skin at two different wavelengths. And then they use mathematical algorithms to estimate the level of oxygen saturation in the blood. Smartphone apps, they don't generate as accurate readings because the camera can't measure the light reflection at two wavelengths. So the oxygen saturation readings that are obtained through an app on a smartphone are not accurate enough to depend on for clinical use. There's actually been a study done on that showed that these are not reliable. So even though pulse oximeters aren't perfect, they're still much more accurate compared to the smartphone apps. Pulse oximeters